About universal health care. Obviously, politicians in Washington haven't got a clue what they're doing. Millions of people are going to be losing health care pretty soon. They just can't afford it anymore. There isn't a plan. There was supposed to be a plan 2 weeks from now. 2 weeks from now, it's all written up. We're about to put it out 2 weeks, 2 weeks, 2 weeks. That was years and years and years ago, and there's no plan. It's always been the mantra has always been repeal and replace the Affordable Care Act, but it's always just been repeal and no replace. So we're going to talk about that today. An option out there is universal health care, particularly Medicare for all. So let's talk about Medicare for all. How would it look? And I am sure we have a lot of people here right now that essentially have Medicare for all. So to use their system, we have some actual guinea pigs, some actual examples, actual people that are using the Medicare for all system right now. And let's see how they like it. All right. So a lot of people say, well, for healthcare, you know what we should do in this country? Everybody should get healthcare like Congress people have, like senators and House of Representatives, congressmen. Well, do you know what system mandated by law Congress people have to have? They have to be enrolled in the Affordable Care Act. They don't get any special federal employee health benefits. Regular federal employees get federal employee health benefits. I got that when I was a federal employee, worked for the Social Security Administration. You work at the Department of Treasury, Forest Service, whatever the case may be, you get federal employees health benefits. But the Affordable Care Act, when it was written, it says, hey, politicians, you have to make this work, because you have to enroll in the Affordable Care Act too. So politicians, your senators, your House Representatives, they have an Affordable Care Act plan, silver, gold, whatever the case may be. So a lot of people think they've got this gold-plated, whatever, but the government does subsidize, pays about 75% of Congress people's Affordable Care Act premiums. So they're getting a subsidy. But other people getting a subsidy? No, we can't have that. That's socialism, right? Anyway, okay, let's put that to a side. So they have the Affordable Care Act. What about Medicare for all? What health care system out there, health insurance system, is the most popular, that people like the most, that insurance companies, private insurance companies, second guess your opinion, the doctor's opinion, second guess your doctor's opinion so they can make more profit? Which health plan out there doesn't have any of those? Which one is the most popular, highly rated, people love it, they can go to any doctor they want, they don't have prior authorizations, they don't have a bunch of deductibles and co-payments, and guess which plan it is? It's not the Affordable Care Act. It's not private insurance. If you have private insurance working through a company, then you probably have prior authorizations. So a for-profit insurance company can second guess your doctor. You have networks, you have monthly premiums that are crazy expensive. You have, deductibles, co-pays, and all the rest of it. If you have a Medicare Advantage plan, you have prior authorization. Well, I'm sure a lot of people already know what I'm talking about. Medicare, original Medicare with a Medicare supplement plan. If you have original Medicare with a Medicare supplement plan, let's say Plan G, those are the happiest campers in America. Everybody always wants to get a Medicare supplement plan. One of the problems with that is that there's a monthly premium to that, so that's why a lot of people get a Medicare Advantage plan. But what a lot of people don't realize, they say, well, the reason I got a Medicare Advantage plan is because it's zero premium. But my regular viewers know what slide I'm about to show here. You're paying for your Medicare Advantage plan. How do you pay for it? You've already paid for it. You're just getting the plan right now at zero premium. You're paying for it. All those decades you paid into FICA taxes, includes Medicare taxes, your $185 Part B premium, general taxation, all that money gets into a pool. And when you sign up for a Medicare Advantage plan, then the government gives that Medicare Advantage plan that you chose, depending on how sick you are and where you live in the country. If you're average enrollee, average, not necessarily sick or anything, they give that company $1,000 a month, every month, whether you use them or not, per member per month. So the Medicare Advantage plan you have, that's, you're saying, oh, it's zero premium. There's deductibles, there's co-payments, there's co-insurance and all that stuff on the back end, but you're also paying the $185, and the government is using the $1,000 or $1,500 or $2,500 you paid into the system, you paid in taxes, they're giving that to the insurance company. So it's not zero premium. So we're talking about Medicare for all. We're talking about it in the future and whether we want something like this. Is this an option y'all think is good? As of right now, we ain't there yet. We're far from there. Insurance companies definitely don't want this. They don't want to be kicked out of the business and make the trillions of dollars they make. The president was right. We don't need these companies to be making all this money. But in the meantime, they are. And so you need to make sure you get your $1,000 back as much as you possibly can by picking the right Medicare Advantage plan, Medicare Supplement plan. You can reach out to Chapter there and they can definitely help you out. You have until December 7th. But in terms of if we switch to a Medicare for all system, for instance, here's how much we're looking to save every single year. The profit motive that we're currently paying, the profits and marketing for these companies, and you know the names of the companies out there, the big companies, the billing battles, all of that. If we got rid of that middleman and it was just you and your doctor, you and your hospital, you and your clinic, then off the top, we would save about $500 billion a year. And there's many, many studies like this, Yale and Kaiser Family Foundation and all those. About $500 billion a year would be saved by getting rid of the profit motive. Number two, lower drug prices. If we're able to, Medicare could negotiate, they just started negotiating a little bit, finally, after decades. But if they could really negotiate everything like the VA, the Veterans Administration does, could save $200 or $300 billion a year. National negotiations like every other country in the world, the reason we haven't done it is because pharmaceutical companies essentially own the politicians, right? So if we could do VA level pricing, just like the VA negotiates, huge savings in drugs, $200 to $300 billion saved every year. If we actually gave those millions and millions and millions of Americans out there health care, not health insurance, not health insurance, but health care. Nobody wants health insurance. Everybody wants health care. That's the mistake people make. They think health insurance and health care is the same thing. No, let's get rid of health insurance and let's really focus on health care. And the number one thing there is those millions of people that don't have health insurance. Hey, if you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter Medicare. I looked for a place that would help you all out, and Chapter Medicare knocked it out of the park. They've got excellent customer service. They look at every single plan in your area, and their help is always 100% free. Give them a call and they'll see if they can help you out, and tell them Dr. Ed said hi. They have to go to the ER. Their ER is their primary care, and that's the most expensive care out there. So if people actually were able to go to the doctor, early treatment, fewer medical crises, the hospitals wouldn't have to take that, someone comes into the ER and they can't pay, the hospitals have to take that hit and they pass it on to everybody else. So that would save $100, $200 billion a year. And then admin waste, simpler claims, fewer insurers. When you go to your doctor's office, next time you go to your doctor's office, ask them, okay, how many people here are actually in healthcare? Your doctor, the nurses assistants, those people are in healthcare. Okay, how many people in your office are in health insurance that actually are dealing with, hundreds of different companies trying to get paid and all that kind of stuff? And ask them, what's the easiest place to get paid? Is it that big company you know about, that other big company? They will say Medicare. Medicare, easy, super simple, it's nationalized. The rules are exactly the same. There is no prior authorizations or denials. I don't need to get well, they're trying to add prior authorizations. That's one of the things Dr. Oz is adding, is prior authorizations. And in some limited states, I think that's one of those things where they're going to do a little bit and try to roll it out to the entire country and make essentially original Medicare Advantage, which he has talked about several times before. But hopefully we will reach out to him and make sure he doesn't do that. So in order to, so let us know what you think. So in order to make this viable, can't do it all at once. So a lot of the options out there, a lot of the ideas out there, the number one thing is it says, okay, let's make Medicare for all. Let's just do it in increments. Like the first year, instead of waiting till 65 to get Medicare, drop it down to 55. So at 55 years old, you have the option to go ahead and get Medicare, and then a Medicare supplement. And then rather than paying a monthly premium for the Medicare supplement, then they'll be subsidized. They'll take that, the money that they're giving to the private insurance companies, that'll cover the cost. And people say, well, if we do all this, it's going to cost so much money. No, every analysis out there, every reputable source out there says, if we go to this system, it will be far cheaper because we're already saving $1 trillion by eliminating all this other stuff. So it's not as though we don't have the money. We have the money. We're just giving it to the wrong places. We're giving it to health insurance rather than health care. So incremental, perhaps. First year, 55 years old. If you're working 55 years old, maybe something like, okay, go to your employer and say, hey, boss, you're paying $1,000 a month for my health insurance. I'll go to Medicare for all. But since President Trump said we can now negotiate with billion-dollar companies, maybe you can say, okay, you're paying $1,000. I'll go ahead and I'll drop off the books. You give me a raise, and let's call it, it's a 50-50 split. You're paying me $1,000 a month through health insurance. Give me extra $500 a month. I'll keep it in my pocket and I'll go to Medicare for all. You save $500. I get $500, and it's a beautiful thing. Definitely need to add, original Medicare needs to add dental, vision, hearing. I mean, how healthy are you in retirement if you can't see, eat, or hear, right? Definitely need to add that, bundle that back in there. Bundle Part D in there, prescription drugs. Again, national negotiations to bring down the prices for that. Again, it's not about it. It's not about money. We got the money. We're spending the money. We're just sending it to the wrong places. And people say it's socialism. No, it's not socialism. Those people that have a Medicare supplement plan, are you socialist? Do you go to any doctor you want? Any doctor in the country that takes Medicare, which are most doctors? The doctors, the healthcare will be for profit. Your doctor needs to make a profit, pay for their, business, and the hospitals make a profit, and more power to them. But we're just cutting out the middleman. Why do we need that middleman? Right? So it's not socialism. I guess if you think it is, then all Medicare supplement plans are socialist. It's not communist. That's the VA, the Veterans Administration. Those are government doctors. Those are government clinics. Those are government facilities. So yeah, we're not talking about a VA type system. And by the way, a lot of people, I'm an old vet, a lot of people are happy with the VA. But I don't think we should do that type of system. I think we should keep, I think we should keep it kind of the way it is.